Okay, so once again, good evening all. Hope I am audible now. So just now I have attended the session of rediscovering repertory by Dr. Gaurang Gaikwad sir. And in this session, in last part, he was telling a rubric, explaining a rubric from a repertory. I think that repertory was of the NAIR. And the rubric we have discussed in our last session was one of the rubric was albuminuria. So albuminuria in kidney diseases, there is only single remedy, that is Coccus cacti. So you can add that sub rubric in your copy of the repertory along with kidney diseases. Coccus cacti is the only remedy, right? Oppo F11 is asking me to speak in Hindi. Sorry, sir. Most of the people over here are good with English. I may talk in Hindi in between whenever needed, or I am unable to translate. So we were talking about the rubric anemia. So you can unmute yourself and someone please. I have given you the homework in last session to see the levels, which are the normal levels in males and females in India. Which hemoglobin levels we can term it as anemia. So I need answers from you peoples. Please somebody unmute and please talk. Dr. Jyoti ma'am, you are unmuted yourself on Redmi 3. Someone is
So females less than 10 and males less than 12.
okay, sir. The levels which I know are 12 to 14 for what we can be females, and 12 to 16 for males. And if the patient is of anemia, if you someone of you have been passed CCMP course in Maharashtra, which is about allopathic practice, then the storage of iron needed after the levels, after achieving the normal levels. So that in cases of emergency or in cases of need, our body can take out that hemoglobin from that store. So to have depot, we need to continue the hematinics of allopathy for more than 3 months after achieving the normal levels. So this is the pathophysiology, or what we can say physiology behind anemia. So we also have to follow the same path. Our homeopathic medicine, we should continue 3 months after achieving the normal levels. Okay. So we were talking about the rubric anemia. There are many remedies under general rubric anemia, but I am going directly to the next sub rubric anemia grief prone. So what is the grief? First remedy is Natrum. Okay. So what is the grip for Natrum? Can anyone explain? What is the grip of Natrum? Please unmute yourself and talk.
So any broken relationships or loss of loved ones?
Very good, sir. So the grip of Natrum will be disappointment from a person who she trusts more or loves more. So you will open page number 498 of Phatak Matra Medica. Page number 498 from Phatak Matra Medica. So we'll read what Dr. Phatak sir writes over there about the grip of Natrum. So the first line I will read out from Phatak Matra Medica. The first line, common salt profoundly affects the nutrition. So you will expect along with grief, the cause of anemia will be nutritional anemia. Patient is eating well but losing flesh, or he is not gaining weight. She or he looks like kachiksi. Then in next line, dropsy and edema, Patak sir writes about. So in cases of severe anemia, you may see these cases of anemia with dropsy or edema anywhere on the body. Okay. Then, but it also affects the blood, causing anemia and leukocytosis. So this is again the remedy for leukocytosis. All you got? All you open the page number 498. You can put yes
Yes,
or no
sir.
in chat. Okay, very good. Then the next line, mind, heart, liver, spleen come under its influence. So on which parts, on which organs the remedy is going to act? It is going to act on mind, heart, liver, and spleen. So you may expect the splenomegaly usually in cases of anemia or along with hepatosplenomegaly in majority of the cases of moderate to severe anemia. Okay. Then if you come below in the generality section, you can see one line, young girls become lovelorn and fall in love with married men. So these are the girls which are falling with love, and if not the girls, young girls unmarried, if a married woman is there and she is in love with her husband, or she is in love, or we can say the old aged women who is in love with her children very much, but somehow she got disappointed, and then the grief has started, the grief has deep settled, and then if she comes with complaints of anemia or the report of anemia, we can think of Natrum. Then we'll move to the next topic of Natrum. On page number 499, there is better in modality, talking long. Then what will be the mind of Natrum? Means we are talking about grief over here. So hateful to persons who had offended him. So there is bitterness. We all know that there is bitterness in Natrum. So what is her bitterness stands for? Her bitterness stands for those relations or those peoples or those persons in her life due to whom she got disappointment and she has gone into that grief. So she is reserved in mind. You can read reserved, then weeps involuntarily without cause or cannot weep. So as she is reserved, she cannot weep many a times, and also the second side you can see that she can weep very easily. Then the next line over there is dwells on past unpleasant memories. You can imagine a situation in a patient, usually a female, that she has been gone through the disappointment in love. She was really caring to her husband and her family. And from some of the relations, she got very much disappointed. But she cannot forget those past events. As like in one of my case, uh, that was not the case of anemia, but I am talking about the grief of anemia, grief of Natrum here. Her husband had marked an offensive remark in in a marriage ceremony where there were many relatives of that lady, and it has passed before 7 to 8 years back. She has kept that in mind, and she was very hateful, very hatred towards her husband due to that thing only. She has kept that in mind for 7 8 years, and when I was taking her case for her ailments at that time, she spoken that, and she started crying before me. So this is the intense grief of Natrum, which is deep seated, and she has always have bitterness towards those relations. So this is dwells on past unpleasant memories. Due to this thing, she will be revengeful for those persons. There is one word revengeful written over there in mind section of Natrum. So what you will get in physical structure, you will get she will be thin, she will be thirsty, as you all of know the Natrum. She is hot, she or he, you can say. Then poorly nourished means she will not take the nutritious diet, but she will take the diet which will satisfy her birds, that she will take. Then you can think of anemia in pubertal age of girls with such a type of grief. With they may be in affair with a boy or in affair with a married man. So it is not necessary to have every time the affair with married man. Then the most important physical symptoms you will get in Natrum cases, that is crack in the center of lower lip, then recurrent aphthous ulcer history of, then these corners will have cracked corners of mouth, they will have there, and due to these past disagreeable events, those she cannot forget. She will be revengeful and she will think on that only, and she will have very much sleepless nights. Okay, then, due to this, she will have always means going through such a phase that she has been deceived by the partner. Then she will have aversion to the opposite sex because of the what we can say that धोखा मिला है वो रिश्ते में, उस वो रिश्ते को लेके उसके अंदर कड़वाहट रहेगी. So this is all about Natrum, and don't forget the characteristic map tongue or patchy tongue. There is a rubric tongue patchy in Patak Matramedica. So don't forget to see that tongue while prescribing Natrum. So this is the first remedy we have discussed over here. Then
Sir,
next,
what is boisterous grief? Sir, what is boisterous grief?
sir, I cannot explain that thing. Someone has explained in last lecture. If someone knows it better, then he can explain about the boisterous grief. He can unmute, and he or she can unmute, and please tell. If anyone is willing, if not, then I will study and let you know in the group, sir. Okay. So are you clear with this remedy up till now? When you will select
Yes, sir.
Natrum in cases of anemia, okay. So we'll move to the next remedy, that is phosphoric acid. It is an acid remedy. You will get the symptoms of acid group like weakness, malaise over here. And along with that, you will also get the symptoms of phosphorus in this remedy. So the next remedy is phosphoric acid. So let me know the page number of phosphoric acid from Patak Matramedica.
546, sir.
Very good. So if you read the first line in phosphoric acid, Patak sir writes phosphoric acid affects the mind, especially emotion side. So in here in this case, we are comparing the grief of Natrum with phosphoric acid. So phosphoric acid will affect the emotional side of mind. Then the next line, weakness and debility, which is the character of acid group. Then if you go below, then mental debility appears first. So patient will have the debility on mental side first, followed by the physical. Then if you come below again, then useful for those young people who grow rapidly and who are overtaxed mentally and physically. So you can think of a age group, young people. So you can think of age group from 15 to 25 years, say. Means those who are studying in schools or colleges, and they are studying and they are in the age of growing phase, they are in the age of adolescence. So in those cases, you can think of. So we have to make the totality in all while prescribing any remedy. Okay. Then when the system is ravaged से meaning हो जाएगा कि विनाश होना, मतलब क्या बोलते हैं ना उसको, शरीर उसका जैसे ना कि worn out हो जाएगा. That condition from acute diseases, mineral excesses and grief, loss of fluids. So grief is the first word coming over here under acid falls. So then if you move again to next, then under modality section worse, then Dr. Patak sir writes emotion, grief, chagrin, unhappy love. So unhappy love. So what was there in Natrum? There was disappointment in love. Here here is the unhappy love. Love is there. The bitterness is not there in phosphoric acid, but she or he is not happy with the love what he or she is getting. If you consider the adolescence age, then you will usually find the age group of adolescents who are studying in, you can say from 9th standard to say 12th or first year or second year of graduation. So you consider that age group, and you can, if they are whatever the love affection they are expecting from their parents and they are not getting, then this we can call as unhappy love. They cannot be hatred towards their parents at that age. What we saw, the hatred maliciousness in Natrum. Then what will be the mental symptom? We are talking about grief. So then the from that grief, she will be apathetic from unequal struggling with adverse circumstances, mental and physical. Is it there in mind section? Apathetic from unequal struggling with adverse
Yes, sir.
circumstances, mental and physical.
Yes,
So what
sir.
is okay? So what is apathetic? So she will lose the interest whatever she or he is doing. He may lose interest in the her routine works or routine studies. Then from unequal struggling with adverse circumstances. So you can imagine a family of a middle class or poor class. He may be traveling with, if we talk about the metro cities like Mumbai or Bangalore, if the student, that adolescent age group student, is traveling with the local to save money of the family, these are adverse circumstances. There may be a single room or one RK flat they are having. They are studying overnight and they are running behind those studies. And these are adverse circumstances they were struggling for. This is one situation I am explaining about adolescent age group. So mentally and physically they are growing and they are fighting with this situation. And if in spite of such a things, they don't get the love or affection what is expected from their parents, they may go into that type of grief. And then up going into that grief, they will have the quiet disposition. They will just stay silent in their home. They will not they will not show any irritability, or they will not fight with the family. But they will answer if something is asked, then they will answer reluctantly. Means they will not have the what we can say, उनको इच्छा नहीं होगी मन से. They will not be willingly answering that thing, but they will answer reluctantly, or they will answer slowly. If the parents ask those children that what happened, then they will not in a condition to answer. Because if you combine the mental picture of phosphorus along with acid, what is there in phosphorus? Phosphorus is always in feeling of not being loved, not being cared, but phosphoric acid will constantly care for others. Why the student, why the children, why the child was going by local? Because to save the money of the family. So after doing so much, if she doesn't get, then she will go in disappointment. Then she will have some foreign some attitude. Then the phase of dull indifference, then quiet, and he will brood over those things. Why I'm not getting such a type of? Then they will get tired. So here comes the first mental tiredness, followed by physical one. So this is the grief of phosphoric acid. The major difference lies between phosphoric acid and natrum is phosphoric acid seems to be phosphoric acid is having sleepiness, then hopelessness, then aversion to business. Natrum will work still having those appointment or grief within herself. She will do her household duties without getting tired. Then then the sleepiness and sleeplessness is the major difference. Sleeplessness is there in natramur, but sleepiness is marked there in acid phos. Okay. So are you clear up to here? I am going little bit fast because we have to cover much of the topics today. So only these are two remedies mentioned by Patak sir. Should I go slow, or in the same pace I can continue?
Continue, sir.
Okay, chalo. Next sub-rubric is anemia, hemorrhages after. So only two remedies are written over here, and both are in 2 marks. First is China and second is Ferrum met. So if you will open
Sir,
China,
please repeat the rubric, please again.
okay, anemia, hemorrhages after, on page number 12 of repertory. Now you will open the China first remedy on page number 208. So the second line, Dr. Patak said it affects the blood. That is sufficient for us. Okay. ब्लड पॉकेट करने के बाद में क्या होगा, मेकिंग इट थिनर सो दैट द ब्लीडिंग विल बी मोर एंड ब्लीडिंग क्वांटिटी विल बी मोर and the time of the bleeding will be more. That is what is meaning of making it thinner. And impoverished means it is quality wise, it is not up to the mark of that quality, so that a person can sustain a good life with such a characteristic of blood. Then in generality, you can see the ill effects of masturbation, vexation, cold stop, corazity, mercury, alcohol, etc. Then in worse modalities, vital loss. Then I would like to ask you one question that in China or in Mathemedica, we see the word recurrently coming in many of the remedies, which is loss of ailment from loss of vital fluids. So my question to all of you is that what do you mean by vital fluids? You can unmute and please talk.
बॉडी के जो भी इम्पोर्टेंट बॉडी
All
फ्लूइड है, जैसे कि
discharges.
अभी वाटर इम्पोर्टेंट है हमारी बॉडी में, तो डायरिया के थ्रू पूरा बॉडी फ्लूइड निकल गया। एक वुमन को प्रोलॉन्ग मेंस्ट्रुएशन हुआ तो निकल गया। वो
Okay, so blood
लैक्टेशन कर रही है
blood
तो
blood is the vital fluid. Then what is, do you someone was talking about discharges, so is the sweat is also discharge, so does the sweat comes under vital fluid? What more are there vital fluids? Please unmute yourself and talk. Okay, blood, semen, perspiration, urine, menses. Okay. So, pardon, perspiration is also vital fluid. Okay, nasal discharges you can think of vital fluid. Or expectoration is a vital fluid. Please stop. मैंने बहुत बड़ा सवाल नहीं पूछ लिया है. Okay. So one more important vital fluid, two more important vital fluids are there in body. One is lymph and second is blood. Okay. Then we'll proceed to the China debility due to discharges. Patak sir writes it in capital words. Is it there?
Yes, sir.
Okay. So the debility in China is due to profuse exhausting discharges, loss of vital fluid, excessive suppuration, diarrhea, hemorrhages. So up till now we can understand that what type of discharges patient has gone through. Okay. Then what will be the effect of this thing? What we can say, the anemia means patient has gone through this loss of vital fluid, or we can say the hemorrhages. So due to that, always remember that every time China patient will have associated complaint of ears. You can say tinnitus, you can say roaring in ear, you can say what hissing sound, some type of abnormality to in hearing. You can always see in those cases of China, in associated with anemia. Then the patient will have due to this profuse hemorrhages, he will have loss of sight. You can see loss of sight on these signs in postpartum hemorrhages cases while the labor is going on. Then faintness you can see in severe anemia. Then ringing in ears is there. Then in severely anemic patient, there may be night blindness. But this night blindness will be come from anemic retina. So what is the anemic retina? Due to anemia, the retina is not getting the required quantity of RBCs to have for more time. So ज्यादा टाइम तक अगर रेटाना को अनेमिक ब्लड मिलते रहा जितना चाहिए सफिशिएंट उतना नहीं मिला, then anemic retina will cause the night blindness in such a person. Then yes, someone has written very rightly over here that semen is a vital fluid. So loss of vital fluid, loss of semen, or the patients who have who are in habit of masturbation, they can also have such a thing. They can also be indicated in cases of China. So this one is more about this. Then one more thing you can see under nose, I think there is a nose, yes. Habitual easy bleeding from the nose, especially morning on rising. So this can be one more cause of anemia from bleeding. Then what will be the look of the face of this person? You can see on page number 2110 of Patra Medica under face, early, sickly, pale, hypocritic, bluish around the eyes. So we are going to see one more remedy in upcoming next what we can say in next session, where there will be the blackness around the eyes. So in China cases, you will get the blueness around the eyes. You can easily see the patient that earthy, sickly, pale face. So paleness is marked in cases of China, but it is not marked in cases of Ferrum. There will be blushing, what we can say, fast splatter or blushing on the face. You can actually see the face red, but the patient will be anemic. Then if you go to the stomach section, then there is one word hematemesis. So it's a remedy from what we can say bleeding from all orifices. Then under stomach section, hungry and yet want of appetite. He will be hungry, but still he will say that he is not getting appetite. Then liver and spleen is enlarged. What we have seen in which remedy we have seen hepatosplenomegaly, I talked about. Very good. Indranil Bavdekar sir has rightly said pale retina on fundoscopy. So which was the remedy I have talked about hepatosplenomegaly? We just have studied only 2 remedies up till now. No? Please someone type in chat box.
Sir, Natmore.
Very good.
Sir,
Chalo.
network
Very good.
and calcareous.
Okay, but we don't have talked about calcareous. Thank you for adding that remedy. Then if you come under female section, then leukorrhea is also bloody. Which are the other remedies you can think of bloody leukorrhea? Then in respiratory, there is first one is hemoptysis. It is written in Italy. So it's very much marked in cases of China. Then under respiratory, if you see Patak sir writes one line, please go through that line on page number 212. The 4th line on page number 212 cannot be a percussion or auscultation because China always have aggravation after touch, but better by pressure. Okay. So whenever you see these patients of anemia of China who are having the history of bleeding from any of those things, means whether it may be the prolonged piles, hemorrhoids, or the menses, or hemoptysis from anywhere, any orifice or epistaxis, but the patient is unable to, patient will not allow you to put your stethoscope on their chest and auscultate of percussion if you are going to do. But if you are going to press the abdomen to see the hepatosplenomegaly, then they will easily they will be comfortable to have that examination. So this is the thing. This is everything about China, but I will add some points. what we have to form the totality of China. The total, how will be the person. So China will have craving of dainty, then sour foods he will like, then sweets, then highly seasoned food. Then he will have aversion to bread, butter, because of why China is having aversion to bread and butter. It is there. It is one of the remedy from that Nash trial. That is the reason behind this.
Flat
Very good, right?
bloating,
So
bloating.
due to fullness of abdomen, he will have aversion to bread or butter. Okay, that's done for China. Now we will move to the next remedy, that is Ferrum. Someone please let me know the page number. It's page number 308. Very good, Dr. Nikita Rana. So the first line here written is iron is present in a considerable quantity in blood as also in many articles of daily food. It affects the circulation, that is first line. Then as like what we seen in phosphoric acid, if you read the sixth line, especially in the rapidly growing youth. So again, adolescent age, you can think of the prescribe this. Then plethoric person, so this is false plethora. In China, opposite to this was the presentation or face of the patient. In pyramid, already I have talked about that. Who though looking strong are so weak that they are unable even to speak of walk. So the mental, sorry, what I can say, the physical debility will be more marked in pyramid, though they are looking robust and strong due to anemia. Then if you read the second last line on page number 308, it writes plus cheeks but pale lips. Lips will be pale, but you can see the redness on the face. Delicate girls. So what is this mean by delicate girls? Someone please. We are having only 1 minute for this meeting. We'll continue immediately. In the next session, we are immediately starting after this. So delicate girls who are constipated.
It's lack of immunity.
Yes, you
Just
can say
guessing,
the
sir.
Sensitive to pain.
Okay. So sensitivity is there. Then what we can say recurrent infections or easy to get infections.